We got this 28-year-old female who came to us with a sudden onset of proptosis and redness, and there is diminishing vision for about 7 to 10 days. And we saw that lady and examined the eye, and we found that she has a caroticocavernous fistula.
Cavernous sinus is a venous space at the skull base, which allows the internal carotid artery to go through it. On the wall of the cavernous sinus, the third, fourth, and sixth knobs also traverses. Now, this cavernous sinus, which allows the internal carotid artery to flow inside, it doesn't have a very fixed structure to keep the ICA holding tight. So it's just floating inside, and hence whenever there is a skull base trauma, most often this internal carotid artery at the level of cavernous sinus is injured, and hence the ICA opens into the cavernous sinus. The cavernous sinus is a low pressure system, and once the ICA opens up to the cavernous sinus, the internal carotid artery pushes all its blood into the cavernous sinus. In turn, the cavernous sinus, which should allow the superior ophthalmic vein to drain inside it, is not able to drain anymore, and there is a retrograde flow of the internal carotid artery blood into the cavernous sinus and into the superior ophthalmic vein. That makes the patient suffer from proptosis and reduced vision.
So now we understood well what is the anatomy of the cavernous sinus and how the internal carotid artery goes in the cavernous sinus. And this problem of caroticocavernous sinus fistula happens when there is rupture of this carotid artery into the cavernous sinus, or the meningeal branches from the carotid artery opens up into the cavernous sinus, which in turn increases the pressure of the cavernous sinus. And once the pressure of cavernous sinus increases so much, then the superior ophthalmic vein, which drains the eye, cannot drain it anymore. Instead of that, there will be a retrograde pressure which will be building up from the carotid into the cavernous sinus and into the superior ophthalmic vein, will result in proptosis and this redness and diminishing vision in such patients. So now that we understood what is a caroticocavernous fistula, we will go ahead and do an angiogram in this young lady, and we will try to find out what is the problem, whether it is a type A, B, C or D, and then accordingly we will go ahead and treat this patient endovascularly.